Hello, I'm Dr. Ian Strawford. I'm a cosmetic doctor and wellness doctor, and I'm the medical director of Skin Excellence Clinics. Do you suffer with puffiness under the eyes or even eye bags of the lower eyelids, and that makes you look sort of tired and run down? Have you been unfortunate and have developed eye bags from having some filler perhaps in that area at some point in the past? And are you thinking, what can I do about eye bags? How can I get them treated? Can they be treated? You may have all of those questions. Well, at Skin Excellence Clinics, we can really help you because we can help manage this problem, and we have many treatments that can help under eye bags.
What causes under eye bags?
So under eye bags or puffiness for the under eye can be caused by many factors. So the main factor is going to be the aging process, and it's due to thinning of the skin losing elasticity, especially under the eyes. It can be due to a prolapse of fat from underneath the eyeball called the infraorbital fat pad, which can come out with the aging process. It sort of herniates out and it creates a bulge underneath the eye, pushing the skin out. It can be the lymphatics of the eyelid. Now, these are the delicate channels that work within the skin of the eyelid that circulate fluid around, called the lymphatics. And many people will see them or the filling up the lymphatics, especially if they're emotional or they've been crying or they've got hay fever. Then you can develop an eye bag or puffiness under the eyes then. And that can be a temporary thing. And we'll often see that from a heavy night where you maybe had too much to drink and not enough sleep. You'll wake up with some puffiness underneath the eyes. But these are temporary things. But certainly with the aging process and the laxity of the skin and the loss of elasticity, it will get worse with the aging process. Unfortunately, in some cases, I see eye bags and puffiness, especially across this lateral malar bag area, from patients who've had fillers in this area in the past.
What treatments can help under eye bags?
So we have a whole range of treatments that can help with under eye bags. In very severe cases where there is excessive laxity and it's in much more advanced stage, then sometimes the only treatment is a surgical removal of that skin. And in cases where there is a prolapse of the infraorbital fat, then that has to be removed surgically along with a lower blepharoplasty. But a lot of our patients have much lesser degrees of eye bags and puffiness underneath the eyes and thinning of the skin. So it's really about rejuvenating the skin of this area and regenerating new and healthier skin that has a more elasticity and more structural integrity. So we have many treatments to do that. The treatments we've been using for many years have involved heat or energy applied to the skin. And the two treatments that we have here that are very effective, one is Tixel, which is a purely heat-based treatment that is applied to the skin of the area under local anesthetic. And the other treatment that can be maybe even more effective for eye bags and the under eye laxity is Morphis 8, which is where needles are fired through the skin and energy, in this case radio frequency, comes out at the tips of these needles within the skin and beneath the skin to tighten from deeper down and to rejuvenate from deeper down. Those are two very effective treatments that we've used for many years. But we've now also started to combine these treatments by regenerating the skin through natural processes using growth factors. So we can either use PRP, which is platelet-rich plasma, injected in and beneath the skin of the eyelids. That can be very effective pre-treatment before we do the other energy-based treatments. And more recently, we've been using polynucleotides injected to the skin and beneath the skin to have the same effect. And that's called skin priming, to get the cells to be more active and more responsive to our energy-based treatments. So those have been very effective non-surgical treatment for eye bags and lower eyelid laxity.
When is surgery needed to treat under eye bags?
So in some cases, surgery is the best option, and we will tell patients that their degree of laxity or the fact that they've got prolapsed infraorbital fat causing the bulging underneath the eye. So we can identify that, and we can steer people towards a surgical solution to meet their needs and their expectations. And in those patients, then we can help facilitate a surgical consultation when we feel that is needed.
How do you treat eye bags caused by fillers?
Increasingly, I'm seeing patients present to the clinic with under eye bags or malar bags, puffiness of this skin coming across the lateral part of the eyelid and into the cheek, called the malar area. And it's secondary to fillers, unfortunately. I find that it's fillers that have been placed inappropriately, perhaps too superficially, which have leaked into this area of the lower eyelid or the malar bag area. And they are then interfering with the delicate lymphatics of the under eye, causing fluid to be retained in that area. And unfortunately, that can become quite a chronic problem and quite difficult to treat. So our approach to malar bags or eye bags caused by fillers is to ascertain the filler there. We may even do an ultrasound to see where the filler is in that area. And we would inject Hyalase, an enzyme, to try to break up the filler that is in that area and remove the filler. But on its own, Hyalase is often very ineffective. But when we combine the Hyalase with, say, Morpheus 8 to go deep into that area, and the energy from the radio frequency can also destroy and break up the filler that is in that area. But that treatment will also rejuvenate the tissue and the skin in that area to create a tightening. And we've had some very, very good results using that combination of removing the filler as possible and tightening the skin with Morpheus 8 to treat those malar bags. And in some cases, we've treated cases of malar bags that we thought would only be treated by surgery, and we're still getting good results non-surgically.